So we'll look at the next inherited condition here, and this is what is known as neurofibromatosis type 1. Neurofibromatosis type 1. Okay, so it has its features. You have features in the eye, features on the skin, café-au-lait spots, patches on the skin. You have some lumps on the skin, so to say, small tumor growths. You know, so just so you know, it's a genetic disorder, and it's caused by mutation in the NF1 gene, okay, which is on the chromosome 17. So it leads to a lot of skin changes and also nerve tumors and all of that. Okay. So it's also called von Recklinghausen disease. So it affects about, if you pick random 3,000 people or 2,500 people worldwide, you see that at least one person is affected. And it's coming in primarily because there's a mutation in a gene known as the NF1 gene, okay, which normally produces what? Neurofibromin, which is a protein that suppresses tumor growth. So because you don't have that protein that suppresses tumor growth, you now have what? Tumors growing anywhere. Okay. So key features is you have what? Skin changes, that's café-au-lait spots. Please pause here to observe because I'll just list and pass. Okay. Frecklings in the arms and groins. Eye findings, you see leash nodules, optic pathway gliomas. Okay. The nerve tumors like cutaneous neurofibromas, plexiform neurofibromas, you know. You can have bone abnormalities where you have bowed legs, scoliosis, pseudoarthrosis, the learning disabilities, attention deficit disorder, seizures, and headaches. The person could also have hypertension, blood vessel problems, and there's increased risk of them having cancers in any other place of the body. Okay, so this is how it looks like. All right, so diagnosis is diagnosed clinically. You just see all these issues. Okay, and you're suspecting. So six or more café spots, two or more neurofibromas, frecklings in the axilla or groin, optic glioma, two or more leash nodules in the eyes, distinctive bone lesions. Okay, and at least you must have dictated that what a relative of this person has what neurofibromatosis type 1. So no cure exists, but they can just do surgery, chemotherapy, radiation, and some drugs like selumetinib for plexiform neurofibromas. Then for bone deformities, they do the bracings and the surgeries. Learning disabilities is just special education for that person.